Hi, everyone. This is Schrier, your representative in Congress. Welcome to our call with your Congresswoman tonight. Thanks for taking the time to join us. It's really important for me to stay connected with you. My job is to serve every person in every corner of our community. Listening to you is a really important part of me doing that. I want to hear from as many folks as possible tonight, and it's just going to take a little bit of time for everybody to join our call. So if you wouldn't mind just being patient here for a minute. And while we're waiting for folks to continue to jump on the line, I just want to make sure everybody knows, if you want to ask a question, please press *3 at any time during the call, and you can get in the queue to ask a question, or press *6 to get help with issues that our staff is here to help you with. Sometimes people need help navigating the federal government. Press *6. We can get you help with things like veterans benefits, Medicare issues, and more. I know a lot of folks are concerned about the coronavirus, so we're going to give you an update and help you answer help to answer your questions tonight. Tonight I have my colleague and Congresswoman here with me, Dr. Kim Schrier. A pediatrician is here with me tonight to help answer your questions. She's not only my colleague and a doctor, but she's also from the state of Washington, so she has a perspective on this that I think is important for our call tonight. Just keep on the line. Press *3 at any time if you want to get in the queue to ask a question, or *6 if you need help with issues like veterans benefits, Medicare issues, and more. Just a reminder to everybody, we're holding. I know people are jumping on the line. Before we get off to a start tonight, I just first want to say thank you to everybody for joining us. These town halls by telephone are a really great way for us to stay connected and for our office to hear from you all. Just so everyone knows who's just getting on, if you want to get in the queue to ask a question, please press *3 at any time. Or you can press *6. Our staff's here to help you navigate the federal government. We can help with things like veterans benefits, Medicare issues, Social Security or disability issues. Please press *6 if you want to get connected with someone in our office to work on those issues. Tonight, I want to make sure everybody also knows that I'm aware that a lot of folks are concerned and interested to learn more about what's going on with the coronavirus. So we're going to give you an update and help answer questions that you might have about that. We are fortunate to have my colleague, Dr. Kim Schrier, here with us tonight to help answer questions. My colleague is a pediatrician and is representing the state of Washington, and she's going to be on the line here tonight to help us answer questions folks are calling in with. Thanks again for joining, and we're going to get started shortly. Hi, everyone. Thanks. I'm just keeping everybody up to date. We're still getting a lot of people joining the call, and we're going to get started here in just a minute. I just want to make sure that everybody knows that you can press *3 at any time during the call tonight to get in the queue to ask a question, or you can press *6 if you want to get connected with our team to help navigate issues you might be having with the federal government. We can help with things like veterans benefits, Medicare issues, Social Security, disability, even the IRS if you're running into snags with them. Make sure to press *6 if you need help with any issues you're having with the federal government. I know a lot of folks are going to call in tonight because they are interested in hearing about or are concerned about the coronavirus. We're going to give an update and answer questions, and I think we have a good amount of people on the line now, so we're going to go ahead and get started. I want to just reiterate, press star 3 to ask a question, and then press star 6 if you want to get connected to our team in Kansas for help with issues you might be having navigating the federal government, things like Social Security issues, veterans benefits. So I understand a lot of folks in our community are concerned about the coronavirus. Tonight we're going to address this situation and help answer questions people might have, which is why I'm very pleased to have Dr. Kim Schrier on the call with us. She is a member of Congress. Here she is from the state of Washington and is a pediatrician, so she's going to bring some really good perspective to the call tonight. Let me begin by saying, as we go into this, that the safety of Kansans and the folks in our community is a top priority. It is very important to me. It's going to continue to be a top priority. That's why our office created a web page to get people connected with the latest available public health information. So you can visit that web page at davids.house.gov/coronavirus. There you can learn more about how to recognize symptoms, help keep yourself and your loved ones safe. All of us, everyone has a role to play in reducing the spread of the virus in our community. In part, that means practicing some of the preventative measures, like washing your hands with soap and water, covering your mouth when you cough or sneeze, and staying home when you're sick. Beyond that, it's important that we all remain level-headed and follow the advice of medical experts. Make sure that we're here to make sure that the public health professionals have the resources that they need, and we're going to keep working on that. So having said all of that, I want to introduce our special guest tonight. This evening, here to help answer your questions is Dr. Kim Schrier. Dr. Schrier is a member of Congress from Washington State. Unfortunately, due to unforeseen circumstances, Dr. Lee Norman from the Kansas Department of Health and Environment, or KDHE, I might refer to it as later on in the call, he was not available as we had previously thought he would be for our call tonight. So Dr. Kim Schrier has graciously agreed to help answer your questions, and we could not be more grateful. We both came to Congress at the same time. She's doing a great job of serving her district, which unfortunately has been hit hard by the coronavirus. So her medical expertise, it has been invaluable at this time. Thanks so much for being with us this evening. Would you like to take a minute to introduce yourself?
Sure, I would be happy to. First, let me just say what a joy it is to work with Representative Davids. She's been an incredible resource, great friend here, and just you should take comfort in having such a fantastic representative going to bat for you in Washington, D.C. Also, on our way in today, we were wondering what people from Kansas call themselves, whether you would be Kansalinos or Kansantonians, and now I know it is as simple as Kansans. So, hello, Kansans. As Representative David said, I'm a pediatrician from Washington State. Right now I'm the only woman doctor in Congress and the first pediatrician. I am right in the thick of it in Washington State, kind of the epicenter of where this all started, and we were particularly hard hit because the first place it really got a foothold and caused tremendous damage was in a nursing home. And we have been blessed with an excellent public health system in Washington State and some of the best researchers in the country, outside of Kansas, I'm sure. And so hopefully we've learned a few lessons that we can help the rest of the country work through. So happy to be here as a resource.
Thank you. Thanks, Dr. Schrier. Before we start taking questions, I want to quickly share, I'll just give you all some updates about the things that my colleagues and I here in Congress have done to address the situation up to this point. Last week, we voted for a coronavirus emergency funding bill, which passed with overwhelming bipartisan support. It was signed into law by the president very shortly thereafter. That package funds a robust response to the coronavirus, including vaccine and treatment development, support for state and local governments, and assistance for affected small businesses. It's clear that we do need to take further steps, though. That's why yesterday I pushed for, I know my colleague Dr. Schrier was pushing for us to take further action, and also that this needs to be bipartisan action. We've outlined some of the common sense measures that we believe we need to take right now to respond. For instance, Kansas has yet to expand Medicaid. So, we need to expand Medicaid, and doing that would provide health care for approximately 150,000 Kansans and help keep hospital doors open, particularly in our rural communities. One of the things that we have had a lot of conversations about is our need to ensure access to paid sick leave. Right now, more than 30 million people in the United States lack access to paid sick leave, many of whom are lower wage jobs that require close contact with the public, like restaurant workers or healthcare aides, and folks shouldn't have to choose between their health and collecting a paycheck that supports their families. So we're pushing really hard for access to paid sick leave. We also need to look at tax relief measures for families and small businesses. During times of economic uncertainty, it's often the middle class and vulnerable communities that suffer the most. We really need to prioritize the needs of families and our most vulnerable populations in any economic package that we put forward. There are many more measures that Congress can and frankly should take to address the effects of this virus on personal safety as well as the financial security of the people in our country. I can assure you that our office is continuing to closely monitor the situation and push for additional steps, any additional steps necessary to address this issue. So we're going to continue to update our coronavirus web page that I mentioned earlier, so we can do all we can to connect the public with resources and information as the situation develops. Again, for folks who didn't hear me earlier or weren't on the line yet, we have a web page that's up with up-to-date coronavirus information as it relates to the 3rd District and Kansas. That's at davids.house.gov/coronavirus. So having said all of the introductory pieces here, we're going to start addressing your questions, but I'll remind folks, and for folks who just joined, please press *3 to get in the queue to ask a question, and press *6 to connect with a member of our team so they can assist you if you need help with navigating the federal government, things like backlogged veterans benefits, stalled tax refunds, Social Security issues, that sort of thing. So we're going to take our first question for the evening, and it looks like Yvette's going to be on the line wondering about, are you there?
Yes, I'm here.
Oh, okay. Go ahead and ask your question.
Okay. Hi. My name is Dr. Yvette Crabtree, and I'm kind of on the front line here. I'm a doctor in Johnson County, primary care. We have urgent care. And so we don't have any access to testing at all for this virus, so we have no way to do it. It's on lockdown. We have to go through the health department. When is it going to be available to all doctors to order whenever we need to order it? And that's my first question. The other question is that we cannot order protective gear to protect ourselves from the virus. So if you want us to not get sick, we need to get, that protective gear. And hopefully we can get some from maybe the national stockpile.
Mm-hmm.
That's my question.
Well, thank you so much for the work you're doing, first of all. And thank you for taking the time to call in, and I appreciate you being on the front lines and really trying to help people here.
Do you want me to chime in about it?
Yeah, I was going to say,
Yeah,
I'll probably pass this off to Dr. Schrier really quickly. The only thing I want to say right up front is that some of the issues that you're talking about with access to the gear that you need, access to tests and that sort of thing, were previously included in the most recent packet supplemental that we passed, and then we're working on hammering out the details for another package tonight that will help alleviate some of that pressure. And then Dr. Schrier, please share your thoughts on this.
Sure, of course. Hi, Yvette. I certainly know what it feels like to be on the front lines there, and first of all, your local public health department should be able to help you get up and running with everything you need. In a typical clinic, you probably already have regular surgical masks, face shields, gowns, and gloves. And those are fine for kind of across the room with your patients, just like you would do with somebody who had the flu. In terms of testing, it's a nasal swab, and because that can make people sneeze or cough, you need to have greater protection for that, and that would be an N95 mask. If you don't have those yet, you can get those from your health department. You can get those by calling the CDC, or you can refer people who you think need to be tested to your local emergency room that should be equipped with those things. It turns out it's not a special magical kit. They have set this up so that you use what are kind of regular swabs, collect one from the nose and one from the throat, and then send those to public health and they run the test. So what happens when you kind of get this whole thing going is if you have a patient who, for example, is medically fragile and has flu-like symptoms and you want to run a test for COVID, you would probably test for flu first, and you would also test for this and call public health to get instructions on how to do it and where to send it. And soon you should have private labs involved. I know we have gotten them up and running in Washington State, and if you have a university hospital, they will probably also be part of the effort to test.
Thank you, Dr. Schrier. And I appreciate, again, I know I said this already earlier, but I appreciate you being able to bring the perspective from a state that is probably about 2 weeks, started having to deal with this about 2 weeks before we did here in Kansas. So one of the things that I know folks are worried about and that the next question deals with has to do with paid sick leave. And Pam, who I think is going to be live here in just a sec, I think has a question related to that. Pam, are you on the line?
Yes, I am.
Okay, go ahead.
Okay. I understand that you are looking at paid sick leave for employees that maybe not be able to work, or if the business is having issues of keeping its doors open for certain reasons during this time. I was just wondering if there are any protections for the small business, since they, in case they're not getting extra income coming in, as they're trying to increase now the salaries by paying sick leave. Is there any protection for them for them?
Yeah. So thank you, Pam, for calling in and asking about this, because this is one of the pieces that we've been hearing from folks about in terms of people reaching out to our office. So I'm glad you asked this question. We are working on a package that my hope is that we'll get the chance to vote on it tonight, maybe late tonight or early tomorrow, to address exactly what you're talking about, making sure that folks have access to paid sick leave, and also making sure that small businesses are not left out of that equation. Because, I serve on the Small Business Committee, and we had a hearing this week to start to explore this very issue. I know a lot of small businesses do not have the resources to cover sick leave indefinitely until, while we figure this whole thing out. There are also a lot of small businesses that are exactly the kind of businesses where people are not going to be able to work remotely. I'm thinking about our restaurants, our hospitality industry, and that sort of thing. So that's actually a big piece of the package that we're looking at putting together and voting on. My hope is that we're going to be voting on it very shortly. This is an area where if we don't take care of our small businesses, that's the backbone of our country, really. I mean, the economic backbone of our country is small businesses, and particularly in the Kansas City region. We are, I always say, entrepreneurship's built into our DNA, and so if we're I'm really glad to be serving on the Small Business Committee so that I can be raising these issues. I would encourage folks to, one, make sure to press *3 if you want to get into the queue to ask a question, but also please reach out to our office and let us know about the measures going forward, because the bill we're going to vote on tonight or tomorrow is it will cover paid sick leave, particularly for folks who are on the front line and doing jobs where they're interacting with a lot of people. It will also make sure that people do not have to pay for the testing, and that's going to be really important, particularly for folks who are living paycheck to paycheck. And unfortunately, there are a lot of folks who don't have paid sick leave already and are living paycheck to paycheck. So we want to make sure to take care of those folks. We're going to go ahead and move on to the next question. So we've got Rebecca coming on the line here. Rebecca, are you?
Yes, hi, can you hear me?
Yeah, and I have a feeling Dr. Schrier might jump in. So.
Well, I wanted to thank you first for what you're doing tonight. I think it's going to be really helpful, and our family's really supportive of it, so we're very grateful. But yes, my question is for the doctor, if that's okay.
Yeah, perfect.
I have got 12-year-old twins that have common variable immune deficiency, and I myself take methotrexate, which is an immune suppressant. We're hearing on the news that they're saying that this virus is something that is going to be a long-term thing. It's not going to be over soon. And we have chosen to kind of self-isolate and just really stay home because of our immune deficiency issues. And I'm wondering if you have a sense of just how long do you think this could be where we would have to be this careful? You know, I know that's probably tough to answer, but, you know, for immune deficient people, it's it's a little bit more scary. So.
Right. Well, Rebecca, first of all, thank you for asking that question. And I think my first quick answer would be, in your position, I would do the same thing that you are doing. That said, there are so many unknowns here. I mean, it's kind of crazy if you think about it that in all of what happened in China, there were no deaths in children under 9. And there are almost none all the way up to age 15. Like, kids seem to not really be affected like this. And we know that there's kids in China with common variable immunodeficiency. We know there's kids there with asthma and diabetes and all the other things that could put you at risk. And so we're trying to figure out how this virus works and why children who, without a doubt, get infected seem to be spared in terms of symptoms. Now, that said, if you have an immune disorder, I think this is a great opportunity to stay home and bond as a family. I think it's a great time to read books together and watch movies together. I don't know how long this will take, but I think that you are taking the safest course. Over time, we're going to learn more about this. And as we learn, it may be that some types of immunodeficiency put you at risk and others don't. But for now, seeing how quickly this has spread in Washington State, suspecting that at least half the cases out there came from asymptomatic people. People just don't know where they got it. I just think that the choice that you're making to stay home and, you know, wash your hands well, only you go to the supermarket, don't take your kids with you, wash your hands when you get home, like all those very common sense measures, I think is the smart way to go.
Thank you, Dr. Schrier. One of the things that you said that I just want to make sure that folks understand is folks use the word asymptomatic quite a bit, and I want to make sure that folks know what that means for folks who are on the line who might not have heard that term before all of this started.
Oh, that's a great question. So maybe I'll just do a really quick overview just kind of the disease, because I think there's a lot of hype out there. I mean, I guess in some ways there's hype and in some ways there's downplaying, and the truth is somewhere right in the middle, that for most healthy people under age 60, this is not going to be a big deal for the most part. I mean, there will be random cases, just like there are with the flu, where somebody young has a horrible course, but for the most part, if you are under 60 and healthy, this is going to be okay. The real trick is to protect people who are vulnerable with immune problems, chronic diseases, or especially people over 80. So it's important that we all do our part. We're also finding out, so there's symptomatic, people who have a cough and a fever, and asymptomatic means no symptoms. And it seems that there aren't very many who are totally asymptomatic. Most just have very few symptoms, and I think that's probably the case with children. Like, they might just seem a little tired one day or have just the slightest cough, and people brush it off as just being nothing. But they may, in fact, be carrying and be able to transmit it to others. And so just driving home the point that to protect the vulnerable in community, we all got to do our part. So even if you're young and healthy, don't have a callous or cavalier attitude about this.
Mm-hmm.
Wash your hands. Stay home if you are sick, even a little bit sick, because you don't want to risk putting other people in harm's way.
Thank you. And that's actually I feel like one of the most important things for us to all keep in mind is that we each have a role that we can play in making sure that we reduce the number of people who are getting infected. And to do that, we just need to follow the safety tips and the public health officials and professionals' advice, washing our hands regularly for at least 20 seconds, making sure if you sneeze or cough that you're covering your mouth, covering your face, making sure that you're sanitizing things, making sure you're staying home if you're sick. And I think that all of those things together, we can help keep our community just that much safer. So the next question, we're just going to keep rolling through these questions here because we have a lot of folks on the line and a lot of people asking questions. Lisa, I believe you had a question about how we can get the word out there. Go ahead, Lisa.
Hi, I just had a quick question about all the people who are out panic buying. There's a run on toilet paper, even in Johnson County, and things like cough syrup. I think it would be really helpful if people understood what they need to have on supply, how much of it they really need. I came home after I did some shopping and went on Amazon. Even they are showing toilet paper is out until April 15th. So I don't know. I don't know if there's a way to put out a list of things, but people really need to know more how to be prepared.
Well, I appreciate you calling in and asking about that, Lisa. That's actually one of the things that we saw almost immediately was that, and what prompted us to put up a page on our website, which is davidshouse.gov/coronavirus, for folks who want to keep up-to-date information about what's going on. It will include information from the CDC, from our own Kansas Department of Health, and we think that one of the ways to help keep people calm and not going into what you consider to be panic buying is to make sure that folks understand really what is going on. And one of the ways we're doing it is with our website. Another way is, trying to make sure we're doing interviews and updates via our Twitter page, our social media pages. And then the other thing is, just by folks getting on the call tonight, my hope is that they'll leave this call with a little bit of a deeper understanding. It's one of the reasons I wanted to have Dr. Schrier here with us, to make sure that she could speak to the things that are, what do we need to be concerned about, and how do we make sure that we stay safe. I don't know if Dr. Schrier, if you want to talk a little bit about the what people might need.
Sure. You don't need a year's worth of toilet paper, and I think that's really important to know that, for most people, we're going to get this, we're going to get over it, and then, we're going to move on with our lives and go shopping at the store again. It's not like we're preparing for Armageddon here. So if you just went to Costco and got a year's worth of toilet paper, why don't you share that with a couple neighbors so everybody has enough to get through 2 to 4 weeks. I think realistically, if you're told to quarantine, that's 2 weeks. If a child gets sick and you're home with them, and then maybe your other child gets sick, you're probably on the outside looking at a month. So get some toilet paper, but not enough for a year. Get some canned food, some frozen food, whatever, popcorn, whatever your munchies are that you want to have around the house. Again, think in terms of 2 to 4 weeks.
Okay.
And plan accordingly. And I think also just, be ready to help a family, another friend. Like if you're fine, the person next door is elderly and gets sick, offer to go do their grocery shopping for them, leave it on their front porch. This is a time when we need to all come together and lend a helping hand. So be in touch with your neighbors who might need more help.
That's actually something that a couple of folks that I know have been talking about is for people that they have in their family who might be elderly and in that much older age range, is maybe trying to figure out ways to do some grocery shopping for them, and then leaving the items outside, and of course using wiping everything down and sanitizing it. But is that something that you've seen folks doing out in Washington, or?
We haven't seen it yet because we really haven't gotten to the point where the numbers are so high.
Oh,
but I think, if you have a neighbor who is at home because they're sick, or they're at home because it's too dangerous for them to go to the store, then and this is the time to reach out and help out. I would just say be reasonable. And I know there's no hand sanitizer available anywhere. And I don't believe Clorox wipes are available anywhere, but I'm sure that they are ramping up. They are the two businesses that'll do great right now.
All right. Well, thank you so much. I'm going to, one of the things, before we take our next question, I was wondering, and this is because I've heard this question asked multiple times, and then one of our earlier callers mentioned working at a critical care or an urgent care facility. I guess I wonder if we need to encourage people to remember not just to stay home when they're sick, but also at what point do people maybe need to think about, do they go to urgent care or a hospital and that sort of thing? Because I think that's probably a question that folks are going to be asking themselves, and this is where your perspective as a doctor is super useful.
Right. This is a really important question, because who is sitting in the waiting rooms at doctors' offices? Well, a lot of the time it's elderly, fragile people with underlying diseases. And so if you are a person who thinks you might have COVID-19, but you have pretty mild symptoms, I would encourage you to stay home and not go and infect the whole waiting room. So I think a lot of this management can happen in your own home or over the phone. Your Department of Health can help, your own doctor can help. And the kinds of questions they're going to ask are you having trouble breathing? And I think that is really the one that would send you to the doctor. As a pediatrician, I will tell you that the degree of fever does not indicate seriousness or the need to go seek medical care. So you could have a fever of 103 with this, just like you could have that with the flu. Fever is not going to physically hurt you until it is 106, which is a huge number, and almost nobody gets that high. So I want you to really think in terms of whether you are short of breath, having trouble breathing, having chest pain. Those are the things that would signal being very ill. And of course, your doctor and nurse are always available by phone to help you make that decision, and they're going to want to know if you're coming in anyway so that they can prepare and have you in a place where you don't infect other people.
Okay. So I think they're all important questions that we've been hearing tonight, and I really appreciate everybody getting on the line. We've got a question from Wanda. Are you on there? Wanda? We might have lost Wanda, or she might jump on here in a second, but It sounded like her question was about whether or not senior citizens should cancel trips. I'm not sure if we're talking about driving trips or if we're talking about getting on a train or if we're talking about getting on a plane. But I have my own thoughts about it, but I definitely want to hear from the doctor. So, Dr. Schrier?
You can share your thoughts. I mean, I'll throw my thoughts out there. I'll bet they're the same.
It's probably the same.
Yeah. So here's what I'm thinking. When you're thinking about travel, I think most people just think about whether they're going to get sick on the plane. And I think that's a totally reasonable thing to think about. So, yeah, if you're older and fragile, would I go on, like, a for-fun vacation right now? No. I would put it off until a time when you're safer. But it's not just because of the plane. It's because let's say you get on a plane and you fly to New York. And while you're in New York, you come down with a fever and a cough. Well, then you're going to have to go isolate yourself for 10 days or so somewhere in New York. And, like, where are you going to go, I think is the big question there. So, you know, here I am, just for you out there who don't know who I am. I'm 51 years old and I have type 1 diabetes, so I'm, you know, somebody who probably shouldn't be flying across the country. But I do. I go from Washington State to Washington, D.C., but both are places where I know I've got a place where I can go isolate myself for 10 days and get over this if I need to. I would hate to have people stranded on a cruise ship, stranded in a place where you can't just kind of hunker down for a while. So I would say if you're fragile and you think you would have a rough course with this disease, postpone that trip.
Yeah, and that's actually what I've been encouraging folks is to make sure if you're in the at-risk categories, if you have an underlying condition, you mentioned diabetes, I know cardiovascular issues, COPD, heart disease, that those are things that are considered underlying conditions. And if you are, once you get north of, I've been telling people 60, so maybe I'm more cautious, but certainly people who are over 70 or 80, unless it's an absolute necessity that you take any kind of trip, I've been encouraging people to just exercise caution and to limit the amount of basically leaving your home.
Yeah, that's absolutely true. Okay. When you look at the mortality rates on this, broken down, you know, between 50 and 60, you're looking at somewhere around 1%. 60 to 70, you're at like 1.5. Once you get up past 80, we're looking at numbers, and these are all preliminary numbers, but it's looking like 15%. That's 15%, and that's a really high risk to take. So if you're over 80 and you're just going on a pleasure vacation, I would advise against it.
Okay, thank you. So we've got Danielle on the line, I believe. Are you there, Danielle? Oh, no, I think she just dropped off. Sorry that took so long to get to. Well, Danielle was calling to ask about equipping our first responders. So one of the things that I know we included previously in the first coronavirus supplemental bill that we did. We passed, this is a bipartisan bill, the President signed it right away to provide a robust response for this public health crisis that we're in. That included medical supplies, healthcare preparedness, and medical surge capacity, and that was close to $1 billion that was included in that package. Dr. Schrier, I don't know if there's anything else you want to add, maybe a little bit of, if there's nuance that you think that folks should hear about.
This has been a real problem in my state. In fact, in Kirkland, Washington, I believe something like 23 out of 27 of their firefighters needed to go into self-quarantine because they went into this nursing home not really expecting that it was going to be coronavirus. Like, it caught us all off guard. So I think first responders need to assume that if they're going to anybody in a nursing home or if they're going to anybody with cough, flu-like symptoms, that they should fully gown and gear up. because, first responders are precious. We can't live without them. We count on them, and we don't want to put them in harm's way. Mm-hmm. But we also can't really afford to have a whole fire department quarantined and not there to help. So just act in an abundance of caution. And, yes, there are materials available, and we're funding that both through the last bill and through this new bill.
Okay. Thank you. So the next question's Zella. Are you on the line?
Yes.
Oh,
yes.
Hello. Go ahead.
Okay, I am right now in Costco, and I am flabbergasted because the line goes all the way from the front of Costco to the back. So,
are you buying toilet paper?
Pardon?
Are you buying toilet paper?
No, I got that earlier. So, anyway, and they probably don't have any. So, everything is really definitely a high stage of, anxiety. Uh-huh. And I've been listening to everything on the call, and it has not reduced my anxiety at all, because if you have a tree that is diseased and you attack one of the little branches and put a Band-Aid on that and put a Band-Aid on another branch and put a Band-Aid on another branch, you're really not taking care of the problem. And from everything I've been listening to for the last 2 weeks, the one issue that can really make a difference and give people a better sense of what to do and take some of the speculation out of their behavior is knowing whether they have COVID, or if anyone they have come in contact with has COVID, or how many people around them have it, which brings it all back to that testing issue. And that always seems to be put on the back burner and at the end and whatever, and there's all kinds of things that the citizens are told to do, but the people in public life, I don't think, are paying attention to the number one thing that can make the most difference, which is the testing. And it's all nebulous, and we have no idea what's going on. And, we're told that if the doctor decides, you can get a test and so on and so forth. But apparently they're still being restricted. We have big labs around the Kansas City metro area.
And I'm glad.
Why can't this issue become number one really fast?
I appreciate you calling in about that, and I'm going to turn it over to Dr. Schrier in just a second. I will say that we have, a number of us have expressed concern about the delay, the initial delay from the CDC with the implementation of testing, and it was something that a lot of us on the congressional side raised as concerns, and I do believe that we have gotten over that hump, and that we're starting to see testing rolling out at a much faster clip than we were seeing before, and so it is being addressed, and it is being addressed much quicker than it was kind of earlier on. And I share your frustration. I shared your frustration at the very beginning with the delay in us getting the amount of testing, and it was part of why we pushed so hard and so quickly to get that first funding package up and then a second funding package up to make sure that they have literally all the resources that they need to get this going. Dr. Schrier, go ahead.
Yeah, I think we all share your frustration. It just doesn't, I think it alarms all of us when we see that South Korea is testing 10,000 people a day. They do drive-up testing. Everybody's finding out. And here we are just limping along. And some of this was not being as ready. South Korea, they just dealt with MERS, another coronavirus, just a few years ago. And so they had all this infrastructure up, ready. They were prepared for this event, and we never had to have that kind of preparation. But now, the CDC is who sequenced this genome and helped China create the test. We've now brought on universities and private labs, so that we have more than just public health doing these tests. We're rolling them out in Washington State. We are having a start to drive-by kind of drive-through testing, and fundamentally, I think that is critical. What we really don't want is a bunch of worried, barely sick people going to their doctor's office to get tested and getting everybody else sick, or going there with, a cold and getting COVID-19. So really, I think that what's critical here, what will be critical, is to have this way to either go to a tent or in your car and get tested and be called the next day with the results, or at some point we'll have an even more rapid test and you could get that. But at this point, it's still about a 24-hour turnaround. So you are right, and you have the advantage of not being the first state to be hit with this.
And then we'll keep folks updated. Please make sure to check out the davids.house.gov/coronavirus, and that will help keep folks up to date on really all of the issues we've been talking about tonight, but also on the testing and all of that sort of thing as we move forward. So we're actually going to get to our last question here. We have Joan on the line. Joan, are you there?
Yeah, I wanted to ask, and this does not concern me. I'm an 87-year-old, living by myself, and I know what to do. But I wonder about all the people that are not insured. Will they be covered to be tested?
Yeah, so I'm glad you asked this. I might not have been as clear earlier, and then also we have people who have been jumping on to the call over the course of the hour that we've been on here. We are literally going to be voting very soon on a second coronavirus supplemental funding package to help address this public health crisis that we're in. And that will include making sure that people, regardless of if they have insurance or not, are able to get tested for free. That folks will be able to get the testing that they need, because this is what we need to do to ensure our public health is the top priority. So the bill that we are looking at voting on in the very near future, the next couple of hours, will include a provision to make sure that folks, regardless of if they have insurance or not, are able to get tested and will not be charged for that. So I'm glad you asked that. Thank you for calling in, Joan. So I want to thank everybody for taking the time to get on the call, even if you were in line at Costco. We are here at the end of the call now. If you weren't able to ask your question live on the line, please know that our team took down your information. We're going to follow up with a response from our office. And if you still have a question that you want to ask, but you haven't spoken with a member of our team yet, please just stay on the line. As soon as we hang up the call, you're going to be able to leave a voicemail, and then our staff will be able to follow up with you at that point. I just want to express my gratitude again. Thank you, Dr. Schrier, for joining us tonight and bringing your perspective. I really appreciate it. And then thank you to everybody who's listening. Thank you for taking the time to join us. I say this all the time, that my job is to serve everyone in our district from every corner of our district, and our office is here to help in whatever way we can. That means being accessible and listening to you. It also means helping you navigate any issues you might be having with the federal government, things like Social Security issues, stalled passports, veterans benefits. These are all things that our office can help with. So please grab a pen if you have one handy. I want to make sure that folks have the contact information for the two offices we have in our district. We've got an Overland Park office. You can reach that office at 913-621-0832. You can also call our office that's in KCK or Kansas City, Kansas. Office is 913-766-3993. I appreciate all of you taking the time again. That's the end of our call. Make sure to stay on the line. If you still have a question you want to leave it on the line, and we will follow up with you. All right, everyone. Have a good evening. Talk to you all soon.